Well, good morning, everyone, and welcome to one of our Birch Methods Core symposiums with special guest Chenglin Hong. Who may be known to several of you because he completed a dual MPH MSW degree here at the UW in 2020. After leaving UW, he went to the University of California at Los Angeles, where he completed his PhD in social welfare in 2024. He's also trained as a fellow in HIV and implementation science at Johns Hopkins and is a scholar in the HIV implementation science program at Northwestern University. And he recently was appointed to a tenure-track assistant professor position in the School of Social Work at the University of Connecticut. He's also a research affiliate at Yale University's Center for Interdisciplinary Research on AIDS. So I have had the pleasure of working with Dr. Hong on a number of projects and still sort of brainstorm with him on occasion. And really pleased to welcome him to give us a talk on systematic reviews. So take it away, Chenglin.
Okay, thank you so much, Susan, for that introduction, and thanks for having me. As I said, I see some familiar face in the audience. I'm sure there will be more people joining, but really grateful for your time to join me, especially if you're on the West Coast. It's fairly early on a Friday morning. As Susan mentioned, I'm here to talk about systematic reviews, and I think not only on systematic reviews, I will talk a little bit about my experience doing several types of reviews, and which I found are really helpful as a doctoral student, in the past couple of years, and I will talk a little bit about what I learned. So I think today is not really about like I know it's like a workshop type of stuff, but I think it's more of a an occasion for me to share some of the lessons I learned over the years by doing this work. Okay. And I will start with the land acknowledgement, as we all know that we're here and acknowledge the Coast Salish peoples of this land. And very briefly about what we're talking about today, I give you an introduction of myself, which Susan already did most of that, and then really an overview of different types of reviews, because I'm sure if you're familiar or you have done any of the reviews, there are several types of review. But today I think I will focus on systematic review and scoping review, I think, which are the most popular in social behavioral science, at least in my work. And then, I'll talk a little bit about how to select a review based on the specific questions that you want to answer. And then briefly, I'm going to talk about, the general process of conducting a review. I mean, there are a lot of guidelines online that you can follow, but again, really, I will share some of the experience I learned over the years and that are really helpful. And then, at the end of the day, we want to publish the review, and I will also share some lessons I learned. I think will be really helpful, when we put together all the fundings and try to make it a publishable journal article. And then, as Susan and I were chatting, that if you're from the University of Washington, I think now you had the privilege of using Covidence, which is a web-based software that can help you facilitate this whole review process, make yourself way much easier. And if you're not at the UW, for example, or from the University of Connecticut, you may want to check with your librarian, because sometimes you may not know that is available. I will also talk about some other tools that can be helpful to facilitate the process. That is free, which is good. As Susan mentioned, I recently started as an assistant professor in the School of Social Work at the University of Connecticut after I get my PhD at UCLA. And I'm a proud double Husky. I received my Master of Social Work and Public Health at the UW. Actually, I have a picture with the dove. And before entering graduate school, I practiced as a medical social worker and case manager, which hugely informed my research interests and the approach I work with the community. And my current work really focuses on addressing health disparities among sexual and gender minority, particularly among gay and bisexual men, and really look at the syndemics, intimate partner violence, HIV, STI, mental health, and how those individual epidemic collectively impact health outcomes of this population. And I'm particularly interested in utilizing e-health, mHealth, and data science approaches to predict health outcomes and deliver interventions that can disrupt the traditional barriers, when people seek help and access to healthcare. So first of all, why do we conduct reviews? So if you can let me know in the chat that how many of you have um, conducted or in the process of doing a review. It could be any type of review, systematic review, um, scoping review, meta-analysis. Oh my God, I'm not sure how to see the chat here. Oh, it's here. You can just type yes if you have done this. Okay, perfect. A long time ago. Awesome. And how many of you, like plan to start a review? Um, thank you, Susan. Um, Perfect. Yeah, I think I'm a social behavioral health scholar or researcher, and especially in the field of HIV prevention and care, and the intersection with mental health, substance use. So is not new that in our field, there are a lot of published study utilizing systematic review and meta-analysis, right? And other scoping review, literature review, and umbrella review, which I will talk a little bit more later. I think there are some benefits in terms of doing review. For example, I think systematic review and other type of reviews can offer a really clear and comprehensive overview of the evidence in the literature on a given topic. For example, what do we know about the barriers to utilizing HIV pre-exposure prophylaxis among key population? What's the prevalence of PrEP uptake or depressive symptom among people living with HIV, right? So on a given topic, those kind of approaches can give us a really clear and big picture. And also it could help us to identify the gaps in the literature. I think from this point, it's very important and very helpful for graduate students, especially if you're trying to, come out with your dissertation because we want to do something original that no one have done that before. So this is a really great way to find out what is missing in the literature. And of course, by doing review, by assess the quality, oftentimes we can highlight some methodological concerns and missing points in the literature. For example, a paper that I will share later on with Dr. Graham that we did to measure or assess the association between mental health outcome and experiencing intimate partner violence. We found that a majority of the studies, actually all of them, are quantitative in design. So there's a lot of information or studies in the literature to see how experiencing violence could lead to adverse mental health outcomes qualitatively using different approaches. And also by doing this, you can assess the consistency across studies and to make pooled evidence, especially when we have adequate quantitative information to utilize meta-analysis. And then, more from a practice and policy perspective, many of these evidence or the published reviews can provide evidence for intervention design and inform practices. And also, many of this published literature can be utilized as tools for future research and teaching, which I will also highlight later on. And of course, in most cases, it will end up being a publishable academic peer-reviewed journal article, which I think is really it's a great way, you know, for graduate students to start writing, especially if you don't have your original data. And that what I did, you know, when I was a student. And I find it's really helpful. And from there, we're going to talk a little bit about different types of review. As I mentioned, you know, if you search just online, different types of reviews, you will see a lot of information. And typically there are, you know, systematic review. For example, this recently published paper in JACE, which also include meta-analysis, which I will not talk too much today. It is oftentimes a part of systematic review, but quantitatively to utilize you know, analysis to have pooled evidence based on the information from included study. And there's also scoping review. For example, this paper I published last year, we're looking at the impact of the COVID-19 on mental health among people with HIV. And there's also narrative review or literature review, rapid review. And this is something I learned recently called umbrella review, or I think it's also called a review of review, which pretty much, you know, one, there's a certain topic that there are enough reviews, so the scholars or researchers will put those reviews together to gather more of a holistic view of the topic or of the literature. So from there, what is a systematic review? Again, you know, you can find all sort of information about the definition. And I put these two articles on the screen, and I found it's really helpful. So the first one said, systematic review is a review that is conducted according to clearly stated scientific research method and it designed to minimize biases and errors. And the second definition also said a review of a clearly formulated question that uses systematic and explicit method to identify, select, and critically appraise research. So I think there are some key points that we can see here is, which are first, you know, so systematic reviews are really based on clearly stated or, you know, pre-decided research questions, which means that even before you conduct the following steps in terms of, you know, funding the literature, creating search strategy, screening all the records, you have to have a very clear question in terms of what you want to do. For example, the review I mentioned earlier on the association between IPV or intimate partner violence and outcome and mental health outcome. So really, before we did that, we want to see, oh, what are the evidence that we can put together to kind of confirm or explore the association between experiencing intimate partner violence and mental health outcomes. And some other examples also include, you know, to measure the effectiveness of e-health or mHealth based intervention to promote, let's say, pre-exposure prophylaxis adherence, right? So before you do that, you have a very clear question that you want to answer that, you know, during this review. And it could also be a examination of proved prevalence of depressive symptoms among adolescents living with HIV. So, you know, you put together all the quantitative information in the literature, and then by doing meta-analysis, you have a clear picture of the results or, you know, this focus of area. So I think it's really important to highlight that before you conduct any steps, you have this clear question. And normally you can discuss with co-authors, advisor, you know, as well as your team members to come up with this question, or you have something in mind that, you know, could be your dissertation topic or, you know, an independent study. And then we'll talk about scoping review, right? So this is another type of review that we can often see in some of the AIDS or HIV and mental health journals. So this is a type of review that, really synthesizing the literature using systematic approaches to identify an existing or emerging body of the literature, right? So this is a kind of review to really look at the literature as a whole and to see what is going on, and also to map the context, range, and nature of the literature. I will also give you an example that the early paper that I published later on in this presentation when we distinguish systematic review and scoping review. So, I think this is a great table or, visualization of how we're distinguishing these two types of reviews. Again, for the research question that what we want to answer in systematic review is really focused, and oftentimes you develop this type of questions before you conduct the actual literature search and screening. But for scoping review, it can be broad and flexible. You can change some of the focuses as you are doing that. And because of the specific focus, after screening the literature, systematic review oftentimes result in fewer results. This is also not, apply to all the cases. It's pretty much depend on, the very specific question that you're focusing on. And there are also different recommended reporting guidelines in terms of, what you should report, what you should synthesize after you selected all the articles. And in terms of analysis, oftentimes, for systematic review, as I mentioned, will include a meta-analysis and also to include a quality assessment on the literature or on the information you find. But for scoping review, oftentimes is mostly a thematic analysis to gather all the information. Yeah, so as I said again, the key difference between these two type of review is really the questions you want to answer or the purposes or the aims. And for scoping review is really to map the body of the literature. And for systematic review is really to synthesize the best available research or, evidence. But I will say these, at least based on my experience, these two reviews are not like mutually excluded, because sometimes when you're doing, all the steps from screening, from data extraction, and you find that we actually don't have a lot of information. So it could turn to be a scoping review, because at that time you may think that, oh, it may be more helpful to have an overview of what we're missing. And also, when you're doing a scoping review and at some point you think that, oh, there are so many articles have been published. For example, I'm helping a team to conduct a review on the association between alcohol use and intimate partner violence among sexual minority men. We first thought, oh, we don't have enough information or data to support this argument or statement. And then we found that there are nearly like 60 published records or articles actually looking at this association that provided empirical data. So now we're doing more of an systematic review as well as meta-analysis to see how this available information can confirm the hypothesis that we have. And yeah, I really want to utilize these two recent publications I have. I'm not sure how I can put this in the chat. So this is the first wait. Well, I can do this later, but these are just examples, of the reviews that I did in the past as a part of the first one, I keep mentioning because this paper just published this week, and I'm super proud because I worked with 3 different students from 3 different institutions, and we've been working on this paper for nearly 2 years. But anyways, as I mentioned, the goal of this paper is really to kind of confirm or, like gather the information to see whether there's a, obvious association between experiencing intimate partner violence and mental health outcomes among a specific population. So we utilized systematic review and meta-analysis. And the second paper, when we're looking at the impact of the COVID-19 pandemic on mental health outcomes among people with HIV. So we don't really have like a previous hypothesis on, how many people, get depressed or experiencing higher levels of anxiety during the pandemic. So we're really interested in, interested in looking at the literature, like how many studies were published. These studies mostly published in high-income countries in the global north, and what kind of tools and mental health outcomes were being reported and used in these studies. So we decided to use a scoping review approach. So hopefully that, clarifies some of the differences and can help you make a decision. But again, I think the best way to make a decision is, first of all, to get yourself familiarized with the literature and talk to senior scholars who publish in the area and, discuss the question to see which approach is the most appropriate. And okay, let's see how we're doing on time. All right. So next, I'm gonna talk a little bit about the review process. Again, I think if you just Google systematic review, how to conduct scoping review, there are a lot of guidelines or suggestions. And here I put out three guidelines that I have read before and I think are useful. But again, there is no a standard or fixed guideline you have to utilize. I think until now, I have 7 or 8 published systematic reviews already, but none of them, or not 2 of them, that we utilize the same approach, because it's also based on the team dynamic you have when you're working with a group of people. People bring different type of expertise. So it really can be versatile, and you have to change and adapt some of the guidelines as you're moving forward. But I think in general, there are, well, I said 6, but I think it's really just 5 key different steps or key steps, which later on we're gonna talk a little bit on covidence, which is a great tool, can help us to go through some of the process. Yeah, but there are, first of all, identify the research question, which I think is the most important. So, when I compare the differences between systematic and scoping review, I think I mentioned like the primary differences is your goal or the research question you want to answer. So I think the first and foremost, you have to be very clear about you want to achieve, or what kind of research question or research questions that you want to answer. It could be, a particular outcome of mental health or behavioral health, such as HIV, STI, and you want to put together the prevalence. It could be, a specific association between an exposure and outcome you want to examine. It could be effectiveness, feasibility of intervention, or more qualitatively, barriers and facilitators to a certain type of healthcare services or, prevention and care strategy. And the way I found, is really helpful to conceptualize a research question which I, kind of adapted from this paper, is the PPCC principle. So, you want to identify a population, right? It could be a population that you're interested in studying, or, as a clinician that you're servicing, and you want to identify a problem, or I won't say it's more like a phenomena you want to answer, because not all the research questions that we answer can be problems. I think that's another thing we oftentimes overlook is, we study oftentimes the negative outcome, but we forgot, the positive sides, such as, quality of life, such as patient satisfaction, right? And then the concept, right? Is it association? as I mentioned, between those two exposure and outcome. And then later on, the context, whether it is in a specific geographic region or it is during a very specific time. For example, when we are looking at this article or this paper, the specific population we have or we're focusing on is people with HIV, and the quote unquote problem we're looking at is mental health outcome and associated factors. And the concept here is really, how the pandemic have created or, impact mental health outcomes. And of course, the context is during the pandemic. So let's do like a small, activity or something. So based on this PPCC principle, you can just brainstorm anything that, could be an interest of you or something you're working on. And if you can, type that in the chat, and we can have this, small activity or conversation. We'll see if there are any volunteers are trying to do this. Or, we can start with, so what's the population that you're studying, or what's the population that you're servicing? It could be people with HIV, it could be adolescents, it could be, LGBT aging individuals. So I think from there, it can really help you to get your research question, or they could be specifically, related to your dissertation or related to your independent study that you're currently working on. Okay, so we didn't see anything right now, but maybe will come up later. Yeah, so again, this is, I think just this PPCC principle is really helpful. Okay, we have a volunteer saying that they're currently working with people of the Philippines. Yes, exactly. So that could be the population that, is a great start of your research question. And the problem is access to mental health countrywide. So I think this point that you mentioned, access to mental health countrywide, give us all the information that we need. The concept is access to care. And then the context is really, I don't know whether you're studying, people in the Philippines or, Filipino American, but, my point is here is that based on those principles, it can get you come up with those different components. And also, I think what's helpful here is later on the second step, when you're identifying the literature or creating your search strategy that can really put into different chunks and help you find the most relevant information. Thank you so much for your participation. Yeah, and then I think what's also important here is, when you have a research question in mind, you want to see whether there is already some paper existing, right? So you don't want to publish something that, let's say, another group of scholar just published on the very similar topic last year, right? Because you might have some similar articles published within this year, but normally it won't be that significant. So I think, it's important at this point, after you have this research question, you go to different type of databases. It could be just PubMed, it could be, Google Scholar, or some of those registration website to see whether there are published records. And if there are not, you could be the one. And this is, I think, really one of the big benefits of publishing a review article is once it's published, it gets cited a lot. I know that citation and stuff like that is not really a great way to measure your impact, but I think it indicates some level of impact that your ability to put together information. And also I think one benefit of publishing review articles is that you don't have to go through the whole ARB process, right? Because some people say the ARB is just like the DMV in academia. Sometimes it just took very long. And Anyways, this is a great way to identify, whether there are existing articles or published studies, or maybe people already registered. In terms of registration, there are arguments on whether you should register or not. I won't talk too much about that because I utilize different approaches when I'm writing review papers. And my senior mentors gave me different advice. I think it's important for you to talk to your co-authors, especially if you have a senior individual in your team. And then from there, we will try to find relevant studies, right? So here, it's really about to put together a strong and comprehensive search strategy, and to utilize those strategies to find the most relevant information. And thanks to the internet now, we have all those electronic databases such as PubMed, Embase, Psychoinfo, not UConn. But I wonder, like 40 or 50 years ago, how people do systematic review. Do they just read all the papers like in the magazine? Anyways, now we have those advanced technology help us to, figure out what's the most relevant records if you have a clear search strategy. And you may find this familiar, if you're reading a review paper, and oftentimes we put together this search query or search string. And then we can utilize this in the electronic databases. We'll practice a little bit later on coincidence as well. And now more and more common people will also do some manual search, in Google Scholar, using keywords, and as well as screening the references of the included study later on to see whether we have any missing records. Again, I think the number one principle here in this step is we will want to include as many as relevant studies as possible. As I was talking to my PhD student, that we rather screen 200 more in relevant study than miss one important study, right? Because oftentimes not a lot of the search string can capture every aspects of the research question that you want to answer. That's why you have to talk to a librarian. I was just talking to Susan that this is one of the least utilized resources that in the university setting or in academia, we don't really utilize the resources from the library, but actually they know a lot in their field. If I remember correctly, or it seems are still the same at the UW, we have the librarian across the health sciences schools, the 6 units like medicine, public health, social work, pharmacy, nursing, and there's another one I can't remember. Yeah, but all these area, they have librarian, have very knowledgeable and experiences in their prospective field, and they will help you to identify the databases that are most appropriate, and then to put together the search strategy. For example, this is the search strategy I utilized for my paper that after consulting with the librarian, I just searched intimate partner violence, mental health, and sexual minority men, and PubMed gave me like 50 records, and we were like, this is not true. It doesn't seem right. So we talked to the librarian, and they give us this very comprehensive search strategy, include keywords and MARCH term, which is medical subject heading. If you look at PubMed, so here the principle is really to talk to them who have expertise and experiences in doing this type of services to give you the best way to find the literature. And then I hope this figure is not too strange if you look or ever read a review article. So this is the Prisma flowchart. Pretty much get the whole review process, from the record that you identified, from how many records were duplicates, and then you can remove, by either coincidence or other tools. And then from there, you move to screening and full text review to decide the final eligibility. And here I want to highlight that, you really have to establish those inclusion and exclusion criteria. before you screen the abstract. For example, when we're looking at our IPV and mental health review, we decide that we only include sexual minority men. So those who identify as women or other identity, we don't include that in the final set of articles. Again, this is really based on the research question that you want to answer. And then I strongly recommend establishing a review team that have very diverse team members. As I mentioned, the project I led, we have people from psychology, from public health, from medicine, because when we are screening those records, a lot of times we have bias when you're coming from a certain or the same area. But other team members may bring some very unique perspective, can help you address some of the bias, and then bring on the expertise that you may have. And oftentimes, when you're reporting those records, the journal or the guideline will ask you like why you're excluding some of the studies. So you want to keep track of the article that you excluded and why. For example, on this flow chart, they found that 29 of those 80 something or 86 records were actually reviewed, but I assume that this paper that they only include records that provided empirical data. And then uh, some software and websites can really facilitate this whole process in terms of we manually screen all these records. For example, Covidence is a very, very powerful tool. And again, if you're at the UW, you have the privilege of using the unlimited version. But I think if you don't have that privilege, you can still register and create one review with the limitation of 500 records. But apparently sometimes, for example, this paper, when they identify the records, they have more than 2,000 articles, which Covidence, like the free version of the Covidence won't be as helpful as it could be. And there's also something called Ryan. This one I use the most because again, it's free and my institution doesn't have Covidence. It's very similar, and if they also have the guideline in terms of how you should utilize and follow the steps as well. And from there, it's really about read all the articles and extract the data. I won't go to the details of what kind of information or data you should extract. Again, this is really much based on your research question. But I think in general, there are two types of data that we want to extract. The first one is very general information, the author, publication year, the study location, context, study design. And then the second chunk of data are really about the very specific questions that your review hope to address. For example, we extracted IPV-related outcome and measurement, mental health outcome, and what kind of statistical outcomes they reported, either is odds ratio, prevalence ratio, or other type of effect size. And I think two key points or lessons I learned over the years here is when you create a form, again, there is no standardized chart or form could help you to do this, but really to pilot test the form first and then refine as needed, because sometimes you have an idea of what type of information you want to extract, but while you're reading the paper, there might be more information you find could be helpful. And really to extract as much detailed information as possible, because you don't want to, when you're writing the actual paper and come back to the data extraction sheet and see that, oh, we actually missed this whole chunk of information. So you have to do that again. And lastly, in terms of summarizing and reporting the results is, again, it's just the final step of utilizing some of the tools or synthesize the data from the extraction sheet. And there are different type of approaches based on the research question that you want to answer. Again, it could be descriptive, it could be a thematic, and sometimes it also include meta-analysis when you have quantitative evidence. And based on the level of the level of details you want, you may also conduct some subgroup unsensitive analysis. For example, a paper that I published with Dr. Ling Wang, who is professor at FSU, who was also a Husky here. We look at PrEP-related outcome and to see whether there's a geographic difference across different regions in China, and so that's just a example of when you're having a lot of data and you want to see whether subgroup or specific type of categories may make a difference. And then there are all types of reporting guideline that you can refer to. As I mentioned, the Prisma flowchart, the forest plot to indicate the statistical effect. And sometimes you could also do like a data visualization to indicate some of the fundings from your specific study. And normally it will include like a key table as well that include the key fundings and information of your study. And in terms of publishing a review article, I don't think I have too many to say, but I think the most important is find an appropriate journal. So again, pretty much based on your field, right? There are some journals that only publish review article, for example, trauma, violence, and abuse, right? So you may want to read some of the papers in those journals and to see how the authors and researchers report their study fundings. And then some journals may request you to report your result from some of the guideline, which also you can find online. Yeah, I think lastly, these are some of the lessons I learned that, before you write or conduct reviews, it's just really important to read many review articles. So from there, you can have a sense of, how these steps were actually implemented in the review and what are some of the key strategies you want to utilize. And, earlier on when I say that, when you're doing a systematic review, you're also kind of establish tools for future review. For example, when you don't have a clear search strategy on intimate partner violence, you can see how other people who published intimate partner violence related paper constructed their search strategy, if that makes sense, right? So when you're publishing your study, future researchers will refer your article as a tool as well. And really to talk to a librarian and specialist in the field. And communication is really important when you're screening all the records and articles. Yeah, here I think persistence is key because sometimes it could be really slow. And some of the guidelines saying, oftentimes it takes like 18 months to 2 years to publish a review article, but it really based on the amount of data you have and the type of revision. And some journals may ask you to do like an updated search if they send back comments from a reviewer. So just keep in mind and to adhere some of those guidelines. I think that's all the experience that I can share. So before we dive into co-avoidance, let's take a water break. And we're gonna do Q&A at the end of the co-avoidance demonstration. All right, so we still have time. Perfect. First of all, I want to declare I have no conflict of interest. It's not like co-avoidance paid me or BIRCH picked me to do this, to introduce covidence. But I think these, again, the resources that we as graduate, well, I can't say we as graduate student now, but as graduate students that we should utilize when your institution has this sort of support for you to help you, go through the study process or to conduct your research. So if you have not done so, I would suggest you to go ahead to covidence.org, or you can just say UW Library Covidence, and then they will help you to register a UW related account. Again, you can use your personal email, but you won't be able to have the unlimited version. Sometimes could be bothersome, and also, using the unlimited version, you will have the privilege of include as many records or articles as possible in your review process. So if you have, I think I can share my screen, but I'm not sure whether it's helpful because, as I said, I cannot use that version of Covidence. So, the interface I have might be different than what you see when you have a UW related account when you register. But again, it's very general when you're looking at the page. So after you register, you could start a review using the prompt they have, and name your review. Again, as I said, Covidence can help you with a majority of the screening process, but it cannot help you to define your research question. You have to do this yourself. But it can help you to create a team, when you're having a group of people in mind that you can include them in a specific review. So you can invite them in a very specific project under the reviewers tab. You can send an invite using their registered email, and when they accept the invitation, they will be able to access this specific project and go through this whole process. So this is I think an example of a review that Dr. Graham and I are doing right now. But it's very user-friendly, right? And it's very easy when you have those information in hand. And from there, you have a team, you have a review on covidence. It's really about download references. So again, I think we can do some small demonstration on PubMed. For example, if you go to PubMed right now, and then you can put together a search string or search strategy of whatever you're interested in the query box, or just in um, the general one instead of the whatever advanced search. But after you type a specific topic or area of focus, you should have a set of articles, right? It could be 50, 100, and 24 or 2200, whatever. So from there, you should be able to download those citations to your laptop or to your device. And then when you save them as a PubMed format, or even CSV format, you should be able to access them and then import them in Covidence. And as I mentioned earlier, you want to do this from different or multiple databases. So when you use the same search string, those databases will give you some of the same results. And then Covidence can help you remove those results automatically based on the similarity across those articles. And you can also manually check that whether there are actually duplicates. And then you can change it back and change it to duplicates based on the decision you have. And from there, Coidence will help you with the screening process. This is again the interface of the duplicates, how it can help you, and how you can also manually check them. And when all the duplicates were removed, you have a set of unique articles or records that you want to screen the eligibility based on the inclusion and exclusion criteria you have, as I said before, the review, and you can manually select. Again, I cannot show you that process because we already finished that step. But it'll be very similar to this page that, for each article or record, you'll be able to vote yes and no, or include or exclude, right? So when you're doing this with other reviewers, you can do this in a blind condition, which means, 3 of you or 4 of you gonna screen all 120 articles. And then when you finish, Coidence will return a result in terms of how many of these records are consistent and how many of them have conflicts. So you can address these conflicts, within a group discussion or group meeting, pretty much based on the guideline recommended. And one more thing that is so good about using Coidence is that it can help you to generate the Prisma flowchart. So pretty much the papers that I wrote before, I need to do this, on like PowerPoint or like a Microsoft Word document to make this manually. But when you finished all the screening and everything, Coidence can help you to generate this of Prisma flowchart automatically. And then, when you have a final set of record, the Coidence can also help you create the data extraction template, which I cannot show you again, but when you are there, you should be able to create that, and all the team members will be able to utilize and then compare, based on the very specific information you want to extract and then put them together to write in your paper. And then it's pretty much set and you can start writing. Again, a review paper can be slow sometimes, but I think it's a really great process, especially if you're working with other graduate students or early stage investigator. It's a really, really great way to know the scope of the literature and to know, what are the gaps that you could address as a scholar. And with that, I will conclude my sharing, and really, really grateful for this opportunity, and go Huskies. You can find me on social media. Actually, as I mentioned, the review I did with 3 different students, all of them reach out to me on social media saying that, oh, I'm interested in doing this with you if you have opportunities. So I think it's a really great way for you to connect with people that outside of your institution. And if you have any questions, or if you're interested in, talking some of the stuff that I covered or missed, you can always reach out to me through email as well. With that, I will stop sharing and we'll see whether we have some questions. Thank you so much. Darwin, go ahead.
Hello. Hello, I'm Darwin del Castillo, an MPH student at UDAP. Thanks for sharing your presentation. I have a question. Do you have experience with these new tools based on AI for systematic reviews, data, for example, Distiller SR?
Well, I haven't done anything with that, but I also heard that is a relatively new tool, can help you screen the records, especially if you looking at like or a specific question, and when the return will give you, like 30,000 articles or abstract or title that you need to screen. I think there are some tools will utilize AI or what kind of whatever like machine learning algorithm to screen those record automatically based on the kind of pre-registered inclusion and exclusion criteria you may have. I personally didn't have anything that I've done before, but I think it's also a great way to start, especially if you have a lot of, record that you generated from the database search. But I think it is also important to, oh my God, did I just spell husky wrong? Uh, Anyways, I think it's a great tool, but also keep in mind that some of those tools will also have biases. So it's a great way, to include this kind of manual procedure just to double check that, everything is in line with the criteria that you set. But yeah, thanks for sharing that. If you have the name of the tool that you just mentioned, you can put in the chat. I guess folks can have a look later on. Thank you so much. And Susan, you have a question?
Hi, thanks for that great presentation. It was really well done, very clearly presented. Can you hear me okay?
Yes.
Okay. So Chenglin, just I'm wondering if you could think back to your time in undergrad.
Mhm.
And because we at CFAR are intentionally in trying to engage more meaningfully with undergraduates who are interested in research. And we've had a lot of interest. And so as far as and we've had ideas, we've just put in a proposal to fund an expanded program to support Indigenous scholars in learning more about HIV science and focusing on undergrads and graduate students. And one of the ideas we had was to especially for undergrads, to have some kind of exposure to research, was potentially to have them conduct literature reviews. And so thinking back to your undergrad time, do you have a suggestion as to the type of review that would be appropriate for someone who is at an undergraduate level?
Oh, that's a great question. I don't think I have a suggestion or, a fixed answer on that. I think it's pretty much based on the research question itself. Again, I think many, why I was talking about scoping versus systematic, a lot of those steps or, suggested guideline are pretty similar. So I would say, again, based on the research question that a team want to answer, it could be the conversation with them. And I think Susan, Dr. Graham mentioned that timeline is also challenging, especially, let's say, because I know some program will do, oh, let's do like an independent study type of thing for a quarter, right? Or for 2 quarters. So it's not really feasible for a very comprehensive systematic review. But I think also, to get students started to or start involving in like at least a small part of a review could be also helpful, because not only they will learn about the skills, but also, to know what is happening in the literature. Because I assume those students who are interested in, they're passionate about a specific topic, or they're passionate about learning research in general. So yeah, I don't think it's I just saw the comments from Roberto, but yeah, I think it's not really like which type of review is more appropriate, but it's really based on the research question and what kind of rule that that you assign to this student or to the specific students that who are interested, if that makes sense.
Yeah, thanks. That's really helpful. And it could be maybe more appropriate because this would be probably like a summer quarter thing.
Right.
Just to have them participate as a member of a review team might be a good option. Thank you.
Thank you so much. Okay.
Thank you very much, Chenglin.
Thank you so much, and have a great weekend, everyone.